Okay, thank you. Our next topic is healthcare. Clearly a timely issue right now. Lori Perez will ask the first question.
Mr. Tong, if the Supreme Court deems the Obama health care law unconstitutional, what's the next step for the U.S. Senate?
Well, let me start by telling you that this is a deeply personal issue for all of us. Many of us have members of our family who've struggled with health care costs and with health care concerns over the last few years. When I knocked on doors in 2006, I knocked on a door in a street in my district and an older gentleman came out. I could see behind him his wife was lying in what looked like a hospital bed, a home care bed. We started talking about the cost of health care, and more I noticed he was getting emotional, and before you knew it, we were standing out in the middle of the street and he was weeping. And I did the only thing I could do. I held him in the middle of the street on a hot summer day as he wept over the cost of the health care that he had to provide for his wife. This is a critical issue for us. We've got to save what we can of the Affordable Care Act. We've got to save the provision for pre-existing conditions. We've got to do what we can to provide incentives for people to adopt health care early and to pay for health care and to join our system so that we can spread those costs over our entire system.
Mr. Oakes, what should the Senate do if it's deemed unconstitutional?
We need to go back and look at it again, and even if they have to pass another law, everyone should be entitled to health care. I also, Mr. Tong spoke about it being personal. It's very personal to me. In 2003, I was a victim of violent crime. My leg was broken in 3 places, my back was broken, and my hand was broken on the streets of Hartford. I ended up having to stay in long-term care for almost 6 months, and at that point the employer's insurance ran out and I had to go on Medicaid. I had to spend every asset I had, it's called a spend down, in order to qualify. So we need health care. They need to revisit it if it is deemed unconstitutional. I'm hoping they do the right thing and they don't go with their gut and they go with the Constitution and they do not turn it down. We need to, everyone has a right to health care, and they need to realize that, and if it goes back to the Senate or Congress in general, we need to go back and get it started again.
Ms. Whitnum, how would you work to restore the tenets of the President's health care law?
Absolutely. The President has modeled his health care law, I believe, after the Swiss model. Switzerland has the highest standard of living in the world, as you know, and they instilled a health care plan fairly recently in our history. I think it was about 5 years ago, and it's caught on beautifully. And our plan is pretty close to it. I must say, the aspect of if you cannot, in Switzerland, afford the premiums, they do subsidize it. And it's not like you're forced to come up with cash if you can't do it. The Obama health care plan is absolutely essential, especially for the Medicare aspect of it that will come due in 2014 and will kick in. We absolutely need to bring this plan in, his plan in, and we have to make sure that if it is kicked out, that something very similar gets instilled. And I believe in a public option, and I'm surprised we don't have that, but we do need it.
Ms. Bysiewicz, what should Congress do if the court rules that way, which is obviously a possibility this June?
We should fight to put that law back into place. Everyone in America deserves access to quality, affordable health care. Here in Connecticut, we have more than 300,000 people that have no health insurance or who are underinsured. And also, there are many people who are just one bad test result away from getting very sick and losing their home or losing all of their financial wealth. And it's important that we have leaders in Washington who will fight to make sure that everyone in our state and our country has access to health care, and to health care that is as good as the health care plan that each member of Congress and the Senate has. And that's what I'll fight for when I go to the Senate.
Next is...
Should I go?
Yes, Mr. Murphy, sorry.
I don't want to be left out.
I don't want to be presumptuous.
It's your turn.
Well, listen, I've spent my entire career on the issue of health care. It's what drove me to run for the United States Congress. And I just listened to my friend Betty. Betty lives in Meriden, Connecticut, has a familiar story. Her husband switched jobs, and in the week or month in between her two jobs, when they didn't have health care, their son was diagnosed with cancer. Guess what? Betty and her husband lost everything. They lost their house, they lost their savings. Betty would tell me, go back to the drawing board. Fight just as hard as you have your entire career. Now, the truth is, we can't just repass the law. I think it'd be a gross miscarriage of justice if the Supreme Court overturned the law, but the answer can't be just pass it again. You'd have to pass something different. And here's where the public option comes into play. I'm a huge supporter of the public option. I worked hard on it to try to get it part of healthcare reform. But its premise is simple. Give people the option to buy into a Medicare-like plan, perhaps discount it for people who need help. If they overturn this law, we can't come back with the same thing. We're going to have to come back with something different. But it's going to have to be an answer to Betty and the millions of other people like her.
All right, our next topic will